With that, our next bill, we're hearing AB 2041 by Assemblymember Juan Carrillo related to emergency medical services. And just as a friendly reminder to everyone in this room and my committee, our committee's jurisdiction is only, I can't read my own writing, only over the end use surcharge in this bill. So just as a friendly reminder, this bill is also referred to the Committee on Emergency Management. Our committee jurisdiction is over the end use surcharge. And with that, Assemblymember Carrillo, you may open, and then each of your witnesses will have 2 minutes.
Thank you, Madam Chair. Thank you, members, as well, for allowing me to present Assembly Bill 2041. Last year, my bill, AB 645, established a requirement for public safety agencies to train 911 dispatchers and how to provide callers with pre-arrival medical assistance instructions related to CPR, choking, child bleeding control, and other emergencies. AB 2041 seeks to build upon this work by adding what's already required by law to the list of mandatory standards public safety agencies must meet to qualify for the State Emergency Telephone Number Account, otherwise known as SEDNA funding. And to be clear, this bill will not affect or make any changes to the SEDNA funding structure or dollar amount. Dispatchers are often the first voice a person hears in a life or death emergency, and we owe it to Californians to ensure those voices are trained and equipped to save lives. Studies show that when dispatchers provide step-by-step instructions over the phone, bystanders are significantly more likely to perform these life-saving maneuvers. This bill is aimed at helping Californians help their family members, their friends, and their neighbors when they are experiencing a critical public health need. Joining me today to testify are Regional Director Katie McNulty, representing the American Medical Response, and Jimmy Pierson, President of Medic Ambulance. And I take it over to them.
Thank you. My name is Katerina McNulty, and I've been involved with emergency medical dispatch for 23 years. I'm here today to share why emergency medical dispatch protocols matter, because I personally have seen their impact and have been honored on 3 separate occasions for providing life-saving instructions over the phone using these protocols. Each of those calls began the same way, someone on the other end of the line experiencing the worst moment of their life, a loved one not breathing, a friend with uncontrolled bleeding from a laceration to the neck, and most recently, an imperiled community trapped by wildfire. With the use of pre-arrival instructions, I was able to give them a fighting chance to survive. In those moments, there is no room for guesswork. Emergency medical dispatch protocols provided structure, evidence-based instructions, and allowed dispatchers to turn a bystander into instant help. Through calm direction, coaching CPR, managing airways, controlling bleeding, delivering breech babies, and so much more, we can bridge the critical gap between 911 call and the arrival of EMS. The 3 awards I received were not about personal recognition. They were acknowledgments that the instructions given over the phone directly contributed to lives being saved. In each case, the patient survived because early protocol-driven intervention began before responders could arrive. These outcomes reinforce the important truth. Dispatchers can be the first chain of survival. When properly trained and supported by validated protocols, emergency medical dispatch saves lives every day, quietly, consistently, and often without public awareness. For the life of me, I cannot imagine answering a 911 call and not having these tools available. How helpless I would feel trying to provide reassurance that help is on the way while listening to someone take their last breaths. I share this testimony to advocate for continued investment in the protocols, implementation, dispatcher training, and recognition of the critical role dispatch plays in emergency medical response. Thank you.
Thank you. Chair, members, my name is James Pierson. I'm the president of Medic Ambulance Service. We operate in 8 counties, 8 counties across Northern California, and are a 911 provider in Sonoma, Solano, and Sacramento counties. I'm also a board member of the California Ambulance Association, past president, and I'm here to support Assemblymember Carrillo and AB 2041. I want to be very clear. This bill is about ensuring that when someone calls 911 in California, they receive life-saving instructions immediately, no matter where they are. At Medic Ambulance, we don't see that as a theoretical issue. It's something that we do live every day. In Solano County, across our cities like Fairfield, Suisun City, Vallejo, and Benicia, we experience inconsistencies and sometimes no emergency medical pre-arrival instructions at all. That means two different patients can activate the same emergency system in neighboring cities and receive two very different levels of emergency calls before we arrive. And in emergencies like cardiac arrest, choking, or severe bleeding, those first few minutes matter. I've been a paramedic for 30 years. I've seen it, or 20 years, sorry. I just added 10 more years of my career, but haven't earned it yet. The difference between getting instructions and not getting them can be the difference between that life and death. Before, like I said, before we arrive. AB 645 establishes that expectation, and AB 2041 simply ensures that expectation becomes a reality. We've heard concerns that this bill is premature or punitive. From our perspective on the ground, the risk is not acting soon enough. Without accountability, implementation can be uneven, and patients will continue to experience gaps in the care depending on where they call from. This bill is not about punishment or punishing anyone. It's about setting a consistent minimum standard of care for 911 callers. I'll end it there. Sorry.
You can respectfully ask for an aye vote.
What's that?
You can respectfully ask for an aye vote. With that, thank you to the proponents. We'll move to any additional witnesses in support. You may approach the mic with name, affiliation, and position only, please. Seeing no additional witnesses, moving on, there's one primary witness that registered beforehand in opposition, Mark Smith from Calmina. Is that correct? You could come sit at the dais if you want.
Do you mind if I stand, Madam Chair?
I don't mind if you stand.
Thank you. I just don't like sitting with my back to members all the time when I talk. My name is Mark Smith. I'm representing the California chapter of the National Emergency Number Association. We are the voice of 911 dispatchers in California. Let me be clear to state, based on the testimony from the witnesses, we are not disputing the need for pre-arrival instructions or emergency medical dispatch, and we all agreed to that last year under the provisions of AB 645. What we are concerned about today, and the reason for our opposed position, is twofold. One, this bill doesn't even take effect until January 1, 2027. So what is happening today is that the sponsors of the measure are presupposing that there are going to be public safety answering points that are not going to follow the law that the legislature implemented last year in AB 645. We don't believe that to be the case. And in any case, we believe that it's premature to bring in a bill with an enforcement mechanism forward today when we still have 9 months to go before the bill is already law. Second, we are concerned about the enforcement mechanism, and I think this fits the jurisdiction of the committee. This bill proposes to restrict a PSAP from any access to CETNA funding if it occurs that this limited amount of training has not been provided. Let's be clear what CETNA funding does. That is the funding that helps a PSAP operate. It helps staff. It helps with the technical infrastructure. It helps with the transition to next generation 911. It helps with all of the things that emergency dispatch does for you and your communities every single day. I'm not sure that we want to deny a PSAP access to this funding because this one issue is not being appropriately addressed. Finally, we would say, and we have asked for this repeatedly, we asked for this during the AB 645 conversation. Please tell us which PSAPs in the state of California do not already offer pre-arrival instructions or emergency medical dispatch as part of life-saving care when you call 911. I'd like to start with an education campaign as opposed to a weaponized enforcement mechanism that restricts access to funding. The sponsors have never been able to provide us with a list of those dispatch centers that they believe are not appropriately providing these triage instructions. Oh, I've heard Solano County. I have heard nowhere else in the state of California. We believe that 99% of dispatch already provides this life-saving care, and that's why there is a provision in 645 that says if you already do this, nothing new has to happen in terms of your PSAP operation. So if they're not going to provide that information to us, we ask that you, the committee, ask for that information so that you can provide it to us. We think an education campaign would be the right place to start if there are people who will not comply with the law that is set to take effect 9 months from now. For all of these reasons, we oppose the bill as it is introduced today. Thank you.
Thank you. We'll move to any additional witnesses in opposition. You may approach the mic with name, affiliation, and position only, please.
Good afternoon, Lieutenant Julio De Leon from the Riverside County Sheriff's Office in opposition.
Thank you. Bringing it back to the committee, are there any members that would like to speak on this bill? Questions? I'd like to move the bill. Moved by Krell, seconded by, what is this?
Questions.
Oh, moved by Krell, second by Bonta. Okay, with that, I will go to Rogers and then Rubio.
Thank you so much. So, Assemblymember, there were a couple of questions that were raised that I think I would like to hear an answer to. One is about jurisdictions that aren't currently doing this, where those are, how prevalent that is. The second question was around if the bill that you passed last year does not go into effect until January, why are we coming back with an enforcement mechanism before we see if there's a compliance problem? And then the third, and I think it's kind of the fundamental one, which is the folks that would have their funding withheld are the folks that probably need to be forced into compliance, but also probably need that as a tool to be able to continue to provide services. So from a local government perspective, which I know you came from and I came from, how is the enforcement mechanism actually going to still allow for service to be delivered at the local level, given that we don't know why somebody's not complying?
I'll answer your second question, then I'll rely on the witnesses. Because this 645 maybe will be effective next year as stated, which is correct. We thought that if we have those that will not want to comply, they can take advantage of having this time in between to be able to implement AB 645. That was the thinking behind it. As far as other jurisdictions that was mentioned that have not provided the services by the opposition, that was a question that we've been asking, and they just gave us that last night. So Inyo County, Mono County, Bishop, City of Palm Springs, City of Hemet, no pre-arrival confirmed on City of Hemet, but City of Blythe also no pre-arrival confirmed. Imperial County del Norte, Season City, Fairfield, Venetia, Vallejo. Again, these are just what they provided to us just last night, because that's something that we've also been asking, but they just provided that to us. To answer your other questions, I'm going to rely on...
And just really fast, if I can jump in, are you willing to provide that to the opposition as well?
Yes.
Right. And then before we go on to the other question, given that the bill that you negotiated last year doesn't take effect until January,
yes,
was this one of the negotiating points in the agreement last year?
I don't recall that was discussed at the time, no.
That's helpful, thank you.
But if the other...
It was not.
Yeah.
It's not part of it.
Okay.
Our opposition witness, who doesn't want to sit at the dais, is now back up at the mic. So I don't know if you, Assemblymember
just feel
Rogers,
awkward,
was it your
Madam Chair,
intention of
with-
asking? Sorry, was it Assemblymember Rogers? Was it your intention to ask the opposition witness?
Yeah, I just want to make sure, because oftentimes we do, when we're working on bills, make agreements in passing a bill. And I want to know, given the discussion last year, was this one of the partial topics that was discussed and in the agreement intentionally excluded? Is this a new issue, or is this a rehashing of a issue that wasn't part of the final agreement?
No, and thank you for the question. No, this is a completely new issue. We did not talk about an enforcement mechanism, and we would not be opposed to talking to folks who will not follow California law, right? We agreed that this is a thing that dispatch centers should do. We just disagree strongly with the enforcement mechanism and the timing. We don't believe it's appropriate.
Great, thank you.
Assemblymember Rubio.
Yeah, just to follow up on that question, are there alternative approaches? And I completely understand we've been going through that with many issues that, or many laws that we've been implementing that, you know, folks are not necessarily compliant. So I understand that part, but is there any alternative approaches that were considered to encourage compliance as opposed to this?
I think the opposition made a suggestion. Why not do an education campaign on their side? They are the ones that are going to comply with these regulations. So if the education campaign is part of what they are suggesting, this is the time to do that.
Thank you.
Any other questions from members? Hoover.
Make a quick comment. Appreciate the bill. I do think, there's some issues that need to be worked out. I'm going to support the bill today, but definitely would love to see some of these things get worked on over the next few weeks.
No,
Thank you.
absolutely. We can continue those conversations again, but again, with the suggestions of the opposition, that education campaign seems appropriate. This will not become effective until next year for them to also comply with AB 645 as well. We're happy to continue those conversations.
Any other questions or comments from Assembly members? Okay, with that, Assembly Member Carrillo, you may close.
AB 2041 will ensure that 911 callers receive high quality of life-saving support when they need it most. With that, I respectfully ask for an aye vote.
Thank you so much, Assemblymember Carrillo, for bringing this bill forward. Your bill does enjoy a due pass recommendation. Should this bill pass, it will move on to Emergency Management Committee. I would encourage you to keep working with the opposition and consider some of the policy recommendations noted in this committee's analysis. For example, how to strike the balance between incentivizing compliance with continuing to properly fund the public safety answering points. I know it's not your intention to defund them. I also think it's perfectly fine for us to have enforcement mechanisms to things that are important.
Thank you, Madam Chair.
911 is funded through end-user surcharges of 5 cents per access line. It's critical that this money remains available across the state to continue 911 operations. We have a motion by Krell, second by Bonta. Members, there's been the motion is AB 2041 by Assemblymember Carrillo is due pass and be referred to Committee on Emergency Management. Will Secretary please call the roll?
Berner.
Aye.
Berner, aye. Hoover. Aye. Hoover, aye. Bonta. Aye. Bonta, aye. Calosa. Aye. Calosa, aye. Krell. Aye. Krell, aye. Lowenthal. Rogers. Aye. Rogers, aye. Rubio. Aye. Rubio, aye. Sanchez. Sanchez not voting.
Thank you, Madam Chair. Thank you, Madam.
Thank you.
That bill is out. We still need a few more votes to add on.